Welcome to the 2026 Member Benefit Session video. Our presentation is designed to update you on any plan changes, new benefits, and information on what's new at Health First Health Plans. We'll cover 2026 benefit changes, 2026 prescription drug benefit changes, and exciting news about our new app. Make sure to fill out the survey attestation after the presentation to receive your $10 gift card in the mail. The attestation is located below the video link on this webpage. And again, thank you for being a member of Health First Health Plans. First, we're excited to announce we've added a new plan this year. We're continuing to offer Health First SunSaver HMO and Health First Premier Access HMO POS plans, previously named Easy Access. For 2026, we are proud to offer our Part B Giveback plan, the Health First Emerald Plus HMO. You'll hear more about that later. Your wellness will continue to be enhanced by the Advent Health network of providers, facilities, and hospitals. Our extended network stretches across 13 counties in Florida, giving Health First Health Plans Medicare Advantage members access to more than 5,600 providers. The Advent Health hospitals, facilities, and providers lists can be found in the provider directory online at hf.org/directory. In-network hospitals include Advent Health hospitals. You can find a complete list of hospitals and providers, along with their contact information and locations, in the provider directory at hf.org/directory. Other hospitals in-network. Here's just a couple of reminders about the great benefits you have in 2026. New Emerald Plus Part B Giveback Plan, HMO POS plan with out-of-network benefits, $0 premium plans and primary care copay, supplemental benefits including dental, vision, hearing, and over-the-counter benefits. Your community health plan since 2014, with more than 10 years of service focused on you. More than 150 $0 prescription drug options. No referrals to see a specialist. More than 5,600 providers across 13 counties in Central Florida. Worldwide urgent and emergency care. $0 gym benefit. Non-emergency transportation. And we're still your community health plan, located right here in Central Florida. Plus, this year, Health First Health Plans has been recognized by J.D. Power for providing an outstanding customer service experience for phone support. Now, let's discuss your 2026 benefit plan changes and updates. We're excited to announce some new and improved benefits for 2026. We've made some changes we think you're going to like. These changes are unique to the plan you choose, so we'll cover each change under that specific plan. For those on the SunSaver plan, your open network dental allowance increased from $500 to $650. Worldwide emergency transportation is now covered at $260. Opioid treatment copay has decreased from $20 to $0. Enhanced disease management is now covered. Your Part D 3-month prescription supply increased from 90 days to 100 days for the same price. You'll pay no more than $35 for your 30-day supply, and in some cases, even less. Insulin copays are 25% of the retail rate, but no more than $35. We did have a few areas that saw an increase in cost share. Emergency room copay increased from $140 to $150. Worldwide emergency and urgent care copays increased from $140 to $150. There have been additional dental changes for SunSaver plan members. Fluoride varnish treatments are now covered, and crowns are now covered every 5 years per tooth. Fillings, which were previously covered every 36 months, are now covered every 2 years per tooth. The Health First Easy Access HMO POS plan is now the Health First Premier Access HMO POS plan. It's now only for Volusia, Flagler, and Highlands counties. For those on the Premier Access Care plan, your over-the-counter allowance has increased from $115 to $125 per quarter. Chiropractic services copays have decreased from $20 to $15. Diagnostic hearing exam copays decreased from $35 to $30. Opioid treatment copays have decreased from $30 to $0. Enhanced disease management is now covered. Worldwide emergency transportation is now covered at $260. Your Part D 3-month prescription supply increased from 90 days to 100 days for the same price. You'll pay no more than $35 for your 30-day supply, and in some cases, even less. Insulin copays are 25% of the retail rate, but no more than $35. We did have a few areas that saw an increase in cost share. Emergency room copay increased from $125 to $130. Worldwide emergency and urgent care copays increased from $125 to $130. There have been additional dental changes for plan members. Fluoride varnish treatments are now covered, and crowns are now covered every 5 years per tooth. Fillings, which were previously covered every 36 months, are now covered every 2 years per tooth. New this year, we are offering the Health First Emerald Plus HMO. Part B giveback of up to $125 per month in your Social Security check. $0 premium and primary care copay. No referrals to see a specialist. More than 150 prescription drugs at $0 copay. Dental, vision, hearing, and over-the-counter benefits included. Standard Part D out-of-pocket costs. Starting January 1st, 2026, the initial coverage phase increased from $2,000 to $2,100. After you reach your maximum out-of-pocket of $2,100, you pay $0 copays for the remainder of the year while in the catastrophic phase. Your annual deductible will be $0 for Health First Sunsaver HMO and Health First Emerald Plus HMO plan members, and $200 for Health First Premier Access HMO POS plan members. We have more than 150 prescriptions that are available at a $0 cost to you. We've updated the $0 copay list, Tier 1, and we now offer generic medication options for all of the following: asthma, lowering cholesterol, reducing blood pressure, managing cardiovascular disease, diabetes and blood sugar control, treatment of depression, antibiotics for infections, anti-cancer drugs, antipsychotics, antiarrhythmics, gastric reflux, treatment of benign prostatic hyperplasia. Novolin RN and 7030 insulins are also Tier 1 with $0 copays for 2026. Good news on insulin. You'll pay no more than $35 for your 30-day supply, and in some cases, even less. Insulin copays are 25% of the retail rate, but no more than $35. Includes insulin delivered via insulin pump. Novolin RN and 7030 insulins are Tier 1 with $0 copay. $0 copay for Part D vaccines include the following: hepatitis A, hepatitis B, Japanese encephalitis virus, HPV, rabies, tick-borne encephalitis, yellow fever, shingles, MMR, HIB, meningitis, typhoid, tetanus, pertussis, diphtheria toxoid, varicella. We have a nationwide pharmacy network available for members while traveling. For the most current list of in-network pharmacies, visit hf.org/directory. 2026 Preferred Pharmacy Network. Within our Medicare Preferred Pharmacy Retail Network, you also have access to preferred pharmacies where your prescriptions can be filled at a lower cost. Some great news to share. Walgreens is now a preferred pharmacy, and PillPack by Amazon Pharmacy is now in-network. Please note, CVS and Target are no longer in-network pharmacies. Supplemental Benefit Overview. Transportation. We want to ensure that you have transportation to any health-related appointments scheduled, such as provider office visits, pharmacy, physical therapy, labs, and more. Depending on your plan, you have from 20 to 32 one-way trips per year. Each trip is up to 75 miles. You can schedule same-day rides by calling our customer service department, or do it yourself by using the Roundtrip app or roundtriphealth.com/healthfirst. To aid in your recovery from an acute inpatient stay, you can receive up to 1 week of meals delivered to your home once you are discharged. A week of meals is the equivalent of 2 meals per day for 7 days for a total of 14 meals. The nutrient-rich meals are designed to speed up healing and get you back on your feet. If you qualify, a GA Foods representative will contact you to start your free meal delivery service. The Emerald Plus plan does not include meals after an inpatient stay. On the first day of each quarter, January, April, July, October, you will receive an allowance of $40 to $130, depending on the plan, added to your prepaid Visa card automatically. Medicines such as cold and allergy medicine, vitamins, first aid essentials, and pain relievers are included. Participating retailers include Publix, Walmart, Walgreens, Family Dollar, Dollar General, and Rite Aid. Your allowance does not roll over and will expire at the end of the quarter. Be sure to use it before the 3 months are over. Receive an emailed copy of the OTC catalog by calling 1-800-716-7737 or visiting athome.medline.com/card. Our physical health vendor is Silver & Fit, and it includes fitness center access, workout plans, home fitness kits, coaching, and their well-being club at no additional cost. You may choose one fitness facility per month. If you make a change, it will take place on the first day of the following month. How to join? Register online at silverandfit.com and select your preferred gym. Call Silver & Fit directly at 1-888-797-7806. Vision Care. Routine vision care vendor, HPMED. $0 copay for one routine eye exam each calendar year. You receive an annual eyewear allowance of $250 to $400, depending on the plan, for prescription glasses or contacts. Coverage is applied to retail value. Exams and allowance must be used at participating HPMED providers. Your allowance is a declining benefit and does not have to be used at a single visit. Find a local participating HPMED provider by calling 833-918-0532 or visiting idoclocator.imedvisioncare.com/healthfirstma. Hearing services vendor, True Hearing. All 3 plans include $0 copay for one routine hearing exam each calendar year, one fitting and evaluation for hearing aids each calendar year. To use this benefit, schedule your appointment through True Hearing and see a true hearing provider by calling 855-639-7424. Sunsaver and Premier Access 027 plans. Maximum annual allowance of $1,000 toward the cost of 2 non-implantable hearing aids every 2 years, 1 aid per ear. Emerald Plus 028 plan. Maximum annual allowance of $500 toward the cost of 2 non-implantable hearing aids every 1 year, 1 aid per ear. Our closed dental care vendor is Liberty Dental Plans. Sunsaver and Premier Access 027 plans. Maximum annual plan allowance of $1,000. Emerald Plus 028 plan. No maximum annual allowance. Coverage is only limited based on frequencies. All plans. You will receive 2 oral exams, 2 prophylaxis, cleanings, and 1 fluoride treatment each calendar year. Dental x-rays, restorative services, periodontics, extractions, other oral maxillofacial surgery, and other services are covered with restrictions. Exams and services must be used at participating Liberty Dental Plan providers. Find a local participating Liberty Dental Plan provider by calling 833-276-0850 or visiting libertydentalplan.com. This year, we also want to give you some tips on communicating with your provider. Here are some important topics to discuss with your provider to help you get the best care possible. Medications. Do you experience any side effects or barriers to taking your medications? Specialty care. Is your primary care provider aware of all the specialty care you are receiving? Falls. Have you fallen recently, or do you have issues with balance? Physical activity. Are you getting an adequate amount of exercise? Bladder control. Are you experiencing any bladder control issues? These are some typical questions that might slip your mind when you get to your appointment, but they're important when it comes to maintaining your wellness. Take control of your health. Here are a few tips to help. Number 1. Speak up. Bring a list of questions with you to your provider visit. If you are confused by the information they give you, let them know. Number 2. Monitor your health. Don't ignore changes in your wellness. Telling your provider sooner can help you get the care you need. Number 3. Appointments and medications. Keeping track of your medications and appointments helps answer questions about your health history so providers know how to treat you. Number 4. Stay educated. Ask questions about your lab results and your conditions. Understanding what is going on with your body will help you take care of yourself. Number 5. Set your goals. Talk with your provider and set wellness goals. Focus on ways you can improve your mental, physical, and nutritional health. One of the most important steps you can take in your wellness journey is keeping up with your preventive screenings. These screenings are used to look for disease before symptoms are present. Talk with your provider to determine which screenings and vaccines are best for you. Here's a list of common screenings and vaccines. Comprehensive Health Assessment, CHA, Annual Physical, Colonoscopy, Well Woman Exam, Bone Density, DEXA, Mammogram, Eye Exam, Dental Exam, Skin Check, Diabetic Screening, Depression Screening, Blood Pressure and Cholesterol Screenings. Vaccines, Flu, Pneumococcal, Shingles. Remember, your provider is here to support you in all your healthcare needs. Take care of your health, earn rewards. It's easy. Health First Health Plans is committed to improving your health and wellness. This program is our way of rewarding you and saying thanks for being loyal to your health. How it works. Earn rewards by completing eligible annual screenings, including Comprehensive Health Assessment, CHA, $50. Diabetic Eye Exam. Reward available to those members diagnosed with diabetes. Pre-diabetes diagnosis is excluded. $30. Sign up for texting through your MyChart member portal. $20. How to use your rewards. Your rewards balance will be loaded onto your Health First Health Plan's debit card. You can use your rewards balance to purchase qualifying items at participating retailers, both in-store and online. Redeem your rewards with your Health First Health Plan's debit card at a variety of local stores, including Publix, Walmart, and Walgreens. We're excited to announce our new app and member portal, MyChart. MyChart allows members to access their plan information from anywhere. Member ID cards will be stored for easy access. View your benefit information. Track your copays, deductible, and cost share information. View your explanation of benefits. Search for a provider in-network. Message with a customer service representative. Premium payments. Pay your monthly premium or sign up for auto pay. And so much more. Getting started with MyChart is as easy as 1, 2, 3. 1. Download the MyChart app from your Apple app or Google Play Store. 2. Select Health First Health Plans from the list of organizations. If you don't see it right away, you can search by name or state. 3. Follow the steps to sign up for an account. You can also access MyChart via website, mychart.myhfhp.org. And if you're a Health First patient and already have MyChart for your medical needs, you can link the two in one convenient place. We call that Happy Together. If you need help downloading the app, you can call customer service, or if you're enjoying this video at an in-person session, we've got a table set up with representatives ready to help you. Thank you for being a valued member of Health First Health Plans. We're glad you chose us to partner with you on your wellness journey. Please don't forget to complete the survey attestation to get your $10 gift card.